Have you ever considered the impact of direct-to-consumer prescription drug marketing? Do you think everyone clearly understands the facts related to advertised drugs? Studies indicate that advertising of prescription drugs can often leave consumers with inaccurate perceptions. Hi, I'm Dana Jones, and this presentation is designed to raise provider awareness about the benefits and risks associated with marketing prescription drugs to consumers. In May of 2010, the Center for Drug Evaluation and Research, a division of the United States Food and Drug Administration, launched the Bad Ad campaign to encourage public health professionals to recognize and report false or misleading prescription drug promotion. The FDA seeks to enforce laws regarding prescription drug marketing that targets consumers in the forms of product claim ads, reminder ads, and help-seeking ads. We'll discuss the types of prescription drug advertisements and their legal requirements, the benefits associated with consumer drug marketing, the risks associated with consumer drug marketing, and the implications for APR in practice based on this information. The FDA provides guidelines to illustrate acceptable components of the different ad classifications based on current laws. Each type of promotion, product claim, reminder, or help seeking, has its own set of legal standards. The APRN, along with other healthcare providers, shares the responsibility of understanding the legal qualifications of these ads in order to help protect vulnerable consumers. Perhaps the most comprehensive consumer marketing approach is the product claim ad. A product claim ad provides the name of the drug, the condition the drug is used to treat, and the drug's benefits and risks. The FDA requires that the claim ad provide both the brand name and the generic name of the drug. The claim ad must also state an FDA-approved use. The claim ad is required to provide a fair balance of benefits and risks. The ads must also clearly represent the populations for whom the drug is indicated. Graphics suggestive of the inclusion of other populations are in violation of applicable laws. Printed claim ads must include a statement encouraging the reporting of adverse effects with phone and web contact methods reporting to the FDA. Another requirement specific to print ads is the inclusion of a brief statement of all risks indicated on the FDA-approved prescribing information. You may recognize the inclusion of statements encouraging consumers to seek medical advice about taking a drug. This is a legal requirement and is typically stated, "Ask your doctor if this drug is right for you." It's acceptable for product claim ads to provide references for further information such as web addresses or phone numbers. A second type of consumer-directed prescription drug promotion is the reminder ad. The laws pertaining to reminder ads differ somewhat from those of other ads. Reminder ads provide the brand name and generic name of drugs, but not the drug's use. Graphics and phrases in these ads should not be suggestive of treated conditions. Because reminder ads do not provide information regarding the drug's use, risks do not have to be included. These ads are not allowed to suggest dosing information. Reminder ads are not acceptable for promoting drugs with black box warnings. A final type of drug marketing directed at consumers is the help-seeking ad. These ads describe a disease or condition and encourage consumers to see their doctor if they have symptoms. These ads do not name a drug and are not typically regulated by the FDA. However, if the name of the drug is mentioned, the violation becomes an FDA issue. While the drug name cannot be given in help-seeking ads, the sponsoring drug company can be named along with a phone number or website for further information. In addition to FDA regulations for consumer ads, there have also been studies on the effects of consumer-targeted prescription drug marketing. Studies have provided evidence that both benefits and negative effects can stem from prescription drug marketing directed at consumers. While views are often conflicting, healthcare providers should have an understanding of outcomes evidence in order to help direct patients and assist in their protection. A literature review revealed more information on negative outcomes related to prescription drug consumer marketing than positive. However, we'll take a look at the benefits for which evidence could be located. One study noted that direct-to-consumer drug advertising provided useful information for patients as active consumers in healthcare, such as information linking certain medical conditions with symptoms they are experiencing. The idea is that patients may realize that symptoms they have been experiencing may be related to a condition for which they should seek treatment. Evidence also supports that consumers learn about new drug therapies for their conditions from consumer prescription ads. In this case, some providers believe this informs patients who may have mistakenly believed that they have no other treatment options available. In a patient-centered care environment, a balance between consumer empowerment and responsible distribution of information must be achieved. There is also evidence suggestive that consumer drug marketing results in negative effects. For example, research has found that consumer prescription drug marketing often omits negative information or findings and also frames information regarding indications, uses, and effectiveness in misleading ways. A randomized control trial found that when fewer risks were mentioned in drug ads, patients perceived the drugs as safer to use. Altered patient perceptions of information relate to possible vulnerabilities, as some consumers may receive the drug information in a context that is not conducive to decision-making. Patient vulnerabilities are individualized, and as such, consumer marketing via mass media fails to consider specific characteristics such as cognitive limits or psychosocial issues. Studies also indicate negative effects upon prescriber and patient interactions. For instance, one study revealed a correlation between direct-to-consumer advertising for prescription drugs and increased irritation and distrust in doctor-to-patient encounters. Evidence shows that marketing of prescription drugs to consumers leads to an increase in prescription volume and also increases consumer demand. This further supports studies that found an increase in providers who felt pressure to overprescribe and overdiagnose conditions related to prescription drug marketing to consumers. A final concern of these advertising practices with regard to providers is the possibility of greater appointment time being spent unnecessarily discussing information gathered from ads. Some researchers have noted a potential for worsened outcomes due to the consumption of time that could have been spent on more relevant patient problems. Once professionals have an understanding of legally acceptable advertising practices and the outcomes associated with prescription drug advertising, that information should be used to help protect patients and achieve the best possible outcomes. Providers, including APRNs, must be conscious of acceptable drug marketing practices in order to identify and report possible violations. Misleading prescription drug information can be reported via email at badad@fda.gov or by calling 855-RX-BAD-AD. Professionals should stay informed of the most current information regarding consumer drug marketing. Professionals can visit the FDA website and sign up for email updates regarding truthful prescription drug advertising and promotion. The FDA website also offers examples of acceptable and unacceptable ads, as well as details from previous violations. Continuing education resources and case studies for healthcare professionals are provided on the Bad Ad program website. Health professionals should advocate for policy change regarding consumer advertising for prescription drugs. When evidence suggests a need for change, caregivers have a responsibility to make their voices heard in order to help protect the safety of the public. For example, in studies, visual displays of drug efficacy, such as charts and tables, have been shown to increase consumers' ability to recall how well prescription drugs work. A drive to implement this change to ad regulation is based on the suggestion that these visuals will reduce consumers' misunderstandings of drug efficacy. Better understanding of prescription drug marketing information may lead to more informed prescription decisions between consumer patients and their providers. Equipped with evidence, providers are poised to impact policy change for the improvement of direct-to-consumer advertising for prescription drugs. An increased awareness of marketing techniques, laws, benefits, and risks better equips healthcare professionals to assume an active role in monitoring and influencing drug ads. Caring for the public involves a responsibility to report misrepresented drug information and advocate for necessary changes. For more information on FDA regulation of prescription drug advertising and promotion, visit fda.gov/drugs.